I'm Dr. I.
I'm Dr. J, and this is
Second Opinion with the Twin Doctors. All right, Doctor, give me the news.
Well, GLP-1 medications, we're talking about Ozempic, Wegovy, Zepbound, they can help with weight loss. Now, that's not news, but what is news is this. We may soon be changing the name of Zepbound to Zeb Rebound, and the reason is there was a study recently done that found that people who take GLP-1 medications within 1 to 3 months of stopping the medications tend to regain anywhere from 25 to 60% of their weight.
It is all about the biopsychosocial model of obesity and weight loss. Zepbound, those medications address the bio, but not the psycho or the social. You have to address all three for successful, long-lasting weight loss.
So now for the main topic, ink under the skin, the surprising health risks and benefits of tattoos. And to discuss, we've got an amazing dermatologist with us, Dr. Eddie DeYoung. Eddie DeYoung, you were not listening. Eddie DeYoung, Kaminska. Thank you. Okay, Kaminska Dermatology. She is a board-certified dermatologist and a Castle and Connolly top doc. Now, just some general stats first, guys. People are tatted in this country. 1 in 3 people have tattoos. Like myself, like Dr. I, he's tatted from stem to stern, including my stem and my stern. All right. And then 22% of people have multiple tattoos, so tattoos are everywhere. So we figured, we're doctors, why not talk about the health risks and benefits of tattoos? So let's do it. Let's do it. All right, so tattoos are generally considered to be safe, I would hope, but there are some risks associated, like the risk of infection. How risky is getting a tattoo when it comes to an infection?
Well, you know, as with anything of the skin, we have bacteria that lives on our skin. And so when you are needling the skin with the tattoo needle, you can introduce that bacteria into the skin and it increases the risk of a bacterial infection such as staphylococcus. That's one of the common organisms that live on our skin. It is a natural organism, it's supposed to be there, but when it gets into the skin, it can cause problems.
So what would you recommend people do then?
Sorry, not to go off. I want to ask one. What about bigger infections like HIV, hepatitis B, C, things like that?
So what a great question. There have not been any documented cases of HIV with tattoo needling. So the risk is significantly low. It's theoretical, but it still exists, right? So tattoo contains, when you're tattooing the skin, you have blood. And if you are tattooing with a dirty needle, so it's very important where you go to get your tattoo.
So no prison tattoos.
No, we enter in prison, I guess.
So you want to have, well, you can have clean needles in prison. It's just you need to have clean needles. You need to clean the skin properly before you get tattoos, and that decreases the risk of infection significantly.
Oh, I don't plan to go to prison, so thanks for the information.
That's what everybody says before they go.
All right, well, let me ask you this question. So I imagine most people, when they're getting tattoos, it's just spur of the moment. I know when I got my tattoos, I didn't give it any thought, I just did it.
That's his life, that's his motto.
I know, I just do it. I think somebody else stole that motto. But anyway, for people who have given it thought, they know they're gonna go get a tattoo. We talked about the risk of infection. Are there certain things that people can do both before and after to at least reduce the risk of infection?
One of the things that you can do is taking a shower or bath, right, to cleanse the skin. It cleans the bacteria out of the skin. But usually when you go to a tattoo parlor, they will have a disinfectant. One of the most potent disinfectants that's over the counter is just rubbing alcohol.
Really?
And that can clear the bacteria off of the skin. Iodine is another common disinfectant that some tattoo parlors will use to cleanse the skin. I usually tell people not to shave before getting a tattoo because it introduces micro cuts into the skin. If they want to shave you the tattoo parlor, then they immediately disinfect the area. So that decreases the risk, but I wouldn't shave preemptively.
So shower and don't shave.
Okay, all right. I was gonna say, they did shave me, but it was in the tattoo parlor like she said. Okay, so what about this one? I've never thought about this, but it's actually kind of scary. What about an allergic reaction to the tattoo ink? Have you seen that? Does it happen? Is it a risk?
It is definitely a risk, and I have seen it in my clinic. Not commonly. I usually see maybe 1 to 2 cases a year. And the most common pigment that induces an allergic reaction is red pigment or cinnabar. It's the other word for it is the main ingredient is mercury sulfide.
Okay, all right. So the red, and that also red somewhere like the white ones too can be problematic, and especially in, oddly enough, sun-exposed areas. Well, most people when you're getting a tattoo, you want to show it off, you know, so it's going to get exposed to the sun. So okay, so red inks, white inks, maybe not. Well, it's not that they're bad, but you're more likely to get allergic reactions with them. What ink is less likely to cause allergic reactions if you got to get that tattoo?
black ink is the least likely to die.
And it's funny, I actually read something that said that black inks are the most common inks used in tattoos. So maybe like intuitively we knew somehow that.
Which I find strange because you think people want these big, vibrant, colorful tattoos, but maybe black is the way they
use
go.
it for like tracing.
Well, tracing the outline.
and
Okay, okay.
things of
That makes sense.
nature.
That makes sense. Okay, another one that is scary, that God never happened to me, but like keloid scarring, granulomas, things like that. Have you seen a lot of that? Is that a risk when you get a tattoo?
Scarring is definitely a risk when you get a tattoo. And do you know what keloid scars are?
I do. But why don't you tell the people?
Okay.
Just put me on the spot. It's like, I do not know. No.
We're just OBGYNs, don't pick on us.
I'm not picking on you. I'm not picking on you. So keloids are excessive scar tissues. Scar tissue that has gone haywire.
Okay.
Okay.
So it's part of your body's normal healing process, but it's just gone berserk, basically.
It's not normal because it has gone berserk.
Like, technically.
Technically. So when you scar, the collagen rearranges itself. So there's an injury to the skin. The collagen rearranges itself. With keloids, the collagen keeps rearranging and goes out of control. And so they create these large, we call them plaques or nodules on the skin that are raised and thickened. And people don't like them. They can be itchy, very itchy. They can just, they don't look great. They don't look nice.
And I feel like the tricky thing with keloids is it's kind of like you said, it's scarring. It's your body's reaction to an injury. So if you try and remove keloids, don't they typically come back a lot?
They can come back.
Yeah.
They can come back. We typically don't like to cut off keloids if we don't have to because of that increased risk of them coming back. There are ways that we can treat them in the clinic, including cortisone injections.
Oh. Now, will it get rid of the keloid or it just kind of
Shrinks.
It shrinks it. Once you have a scar, you can never get rid of a scar fully.
Okay. And one other question, I'm sorry, I'm focusing on keloids now, but is it true? I thought I remember from medical school, but like I said, I'm just an OBGYN, so don't pick on me, but keloids typically are
Just an OBGYN.
No, just an OBGYN. Okay, I'm an OBGYN. Thank you. No. But do you typically see keloids waist up, or can you see keloids anywhere on the body?
You can see keloids anywhere on the body.
Okay.
I've never seen keloids on the palms or soles.
Okay.
Or inside someone's mouth.
We're gonna see that in your office tomorrow.
Exactly. You just talked it up.
But they can happen anywhere on the body.
Interesting, interesting. So, okay, we've said that there's a risk of infection, a risk of allergic reaction, a risk of keloid scarring, things like that. Is there anything that people can do preemptively to maybe see if they're at higher risk for allergic reaction or potentially scarring?
You mean like testing? Like you mean what? Like
Yeah.
skin allergy testing, things like that?
You can do it, we call it patch testing, but it's not truly patch testing. You can inject a little portion of the dye into the skin, underneath the skin, and wait. Typically, I tell people to wait at least 48 hours, if not 1 week, to see if you have a reaction.
Okay.
Sometimes with tattoos, you can have a delayed reaction. So it may not present in that 1 week time frame or the 48 hours. It can present a year later. It can present several months later.
But would they have to get testing for each color they wanted to get in the tattoo, or just one dye sufficient?
Each color you want to get in
color.
the tattoo.
Say we're just OBGYNs, but you just said certain dyes are more allergic than others. Didn't she say?
I did. I had to ask.
If someone wanted to get a red dye or a white dye, we talked about that. The white dye contains titanium dioxide. I would recommend those because those are the higher allergens. They have a higher risk of allergy.
Okay, so if you're gonna get like a red tattoo, white tattoo, because those are more likely to cause allergic reactions, consider getting the patch test.
Or if you're going to get a tattoo with lots of colors, if you didn't want to test each dye, I would definitely test the red or the white.
The big offenders.
The big
that-
offender.
That makes sense, actually. That makes sense. Okay. All right. So another question I have is, there's metals in tattoos, right? You have your chromium and your cadmium and
Cobalt.
yeah, stuff like that. Do these metals typically just stay where the tattoo is? Does the ink just stay where the tattoo is? Or does it, tend to migrate over time?
Usually the ink will stay where the tattoo is.
Okay.
Although there is some data that the ink can get taken away by our lymphatic system.
Okay.
There are cells in our body called macrophages that can take some of the ink and move it to the lymph nodes.
Okay.
Lymph nodes are a railroad way in our body that help clear toxins and things such as infections, toxins out of the body. And so those pigment from the tattoo have been found in lymph nodes.
Okay. So
Sorry, please.
I was going to say, so my next question is, I'm starting to worry about myself. Yeah, with my tattoos. No, but my next question is, okay,
Got ink all over.
I'm in trouble. I'm in trouble.
And I'll tell you, I've got like 5 tattoos, but this guy has got a tremendous number of tattoos.
16?
Everywhere.
I've lost count. I've lost
yes,
count.
yes,
I've
yes,
lost count.
including some rather horrific ones, but that's another story for another time.
I got cover-ups.
Yeah, you did. Literally, it was the worst tattoo I've ever
It was a horrible
seen.
tattoo.
I will say it was, our grandmother passed. He wanted to get a tattoo for her, so he said, I'm going to get an angel.
My intention was good.
His intention was good, but it's going to be a female angel because it's our grandmother. So it's
Duh.
an angel with long hair, and it's kind of looking wistfully away. And it basically looked like
It looked
this
like Jesus.
weird, demented Jesus. It was like the weirdest thing ever. I said, Idris, you've got to get rid of that thing. At first, he's just like, it's 10 days later, the thing was covered up. But anyway, okay. So these inks get drawn into the lymph nodes. Is there any risk if you have these inks and these metals, and not just risks, is there any risk of cancer, I guess, that's what I really want to know. Is there any risk of cancer?
We cannot say confidently that tattoo ink has been affiliated or related to cancer.
Okay. All right.
There are some studies that suggest that it may increase the risk,
Yeah.
but there are no firm studies that show it does increase the risk.
Okay. But if the ink is going through the lymphatics, going through the lymph nodes, is that a good thing for your immune system? No, I'm serious. Or is it a bad thing for the immune system, or it really doesn't affect the immune system at all?
It depends on the person. So everyone has a different immune system, and some people's immune system may be hypersensitive, right? So they may look at the ink and say, no, get out of here, and create inflammation.
Yeah.
Other people's immune systems will say, hey, no problem. Doesn't phase it at all. It's almost like warts. You guys know what warts are?
Yeah. Oh, we are OBGYNs. We are very familiar with warts.
Probably in the areas that I don't see as frequently. But warts are a virus of the skin.
Yeah.
And some people's immune system says, nope, you don't belong here, and they won't get warts.
Right.
And other people's immune system say, oh, the wart virus has a party.
Exactly.
Yeah. So similar concept to the ink dyes in the lymph nodes.
Yeah.
Some immune systems say, hey, no problem. And others say, hey, you don't belong here. Clear.
Right. So, okay, what about this? So I read about immune system training, where there's this thought that, you expose the immune system to something that shouldn't be there. Your immune system's going to respond because that's its job. Now it's kind of at attention, and it's not just going to respond to this one thing, but it's ready to fight other things, viruses, bacteria, cancer cells, things like that. Is there a possibility that in getting tattoos, you prime your immune system, it's now at the ready and it's actually more capable of fighting things that actually are problematic?
That's an interesting question. I don't know if I've seen any data concretely in the medical literature that shows that tattoo priming primes the immune system.
Okay.
So I say we don't know yet.
I'm going to go with the no on that one. So, I've got a few tattoos, like we've said, and some of mine are bigger, right? And so they take a lot of time. And so you get tired of Netflix, and so you chit-chat with the tattoo artist. And he told me about somebody who had we'll call it their posterior exit tattoo, right? A very sensitive area. Are there certain areas of the body that absolutely should not be tattooed? I'm asking for a friend. Are there certain areas of the body you just should not tattoo?
I would say that in those sensitive areas, there is a higher risk of infection likely, especially in the posterior area, because there's a lot of bacteria that comes out of that way. But I've seen tattoos in the mouth, on the lips.
I was going to say, I mean, bacteria, posterior area for sure. But what about people put tattoos in the mouth?
They do
Risk
put
of
tattoos
infection
in the
with
mouth.
that as well?
Yes, there's a risk of infection, but that doesn't mean you can't do it. Okay. I mean, even people have tattooed their eyes, even.
You're literally reading my mind. That was going to be the next one. I've seen people who've tattooed their sclera.
Yes.
That's okay? I want that to be okay, because Dr. Eddie don't endorse it, But is it?
Not endorsing that.
Dr. Kaminsky approved.
I am not endorsing that, but what I can say is that you need to be careful and make, logical decisions, because to undo tattoos is not easy.
Okay.
And it can be very costly. It's not covered by insurance. Tattooing typically is not covered by insurance. And to remove them, it takes many sessions.
So I'm thinking logically, what does the logical thought process look like that leads you to tattoo your sclera? I can't imagine. But okay, so I got a question. You mentioned tattoo removal.
Yes.
Okay. Easy to do?
It's easy for a trained provider to do the tattoo removal. Is it easy for the patient or the client?
Right.
Not necessarily. It is not comfortable. It feels hot. We
So
use
what do
we use a laser called a Q-switch laser. That basically what it does is it disperses the pigment in the skin. So it creates when the ink is put into the skin, it comes as these particles. And what the Q-switch laser does is it disperses those particles into tinier fragments.
Okay.
And then when they're in those tiny fragments, the macrophages of the lymphatic system can pick it up and help clear it away.
How long does it take? Like, can you do it all in one session, or do you have to go back
Multiple sessions. It takes multiple sessions to clear a tattoo.
And then we talked about the risk of infection and scarring and things like that when you get the tattoo. Do you have those same risks when you remove the tattoo?
So there's a risk of burning, right? Because laser is an energy source. And so depending on the setting and the skin type, the skin can be burned. And if your skin gets burned, depending on what kind of skin you have, you may scar.
Yeah.
Okay. All right.
No.
Makes sense.
This has been a very interesting conversation. Thank you so much for joining us. We're gonna have to have you back when we get all those questions from people who've gotten their sclera tattooed. But
But tell people, where can they find you?
I'm located in Chicago, in the city. I've got 2 practices in downtown Chicago and River North, and on the north side in North Center.
social at all? Social media?
Kaminska Dermatology
Okay.
on Instagram and Facebook.
Facebook.
Oh,
I like
but I don't look old.
No, you do not. You do not. All right, well, hey, thank you for joining us. We'll have to do it again real soon.
Yes.
Okay, so we just talked about some of the surprising health risks that you can see with tattoos, but now we want to flip the script. We want to talk about some of the ways that tattoos can be used to improve health and wellness, and we've got 2 amazing people here with us to discuss it. We've got Liliana Rusnick. She is the owner and proprietor of Fancy Schmancy. It is a paramedical practice in Highland Park, Illinois. If you know anything about the Chicagoland area, it's very fancy schmancy. And we've got Vivian, who was one of her patients, and they've got some amazing stuff to share. So, I want to start by telling everybody what paramedical tattooing is, because I learned a lot about it researching the show, but why would I do that when we've got one of the best here? So please tell everybody, what is paramedical tattooing?
So, as we know, we have permanent makeup category, everything that concerns microblading, eyeliner, and lips, everyone knows about it, but we have also paramedical. The paramedical, this is where we actually approach all the scars, stretch mark, vitiligo camouflaging, that it's autoimmune disease that people are having, and also areola 3D after mastectomies, or any type of correction after any type of surgery.
Okay. Now, Dr. J's made some comments about some of my not so great tattoos. So, when it comes to cosmetic tattooing, there's some that are good, some that are bad. Paramedical tattooing, how do you get into it? Can anybody do it? Are there certifications, training? How did you get into it?
So everyone can learn it if they want it, of course. There is a lot of permanent makeup artists that want to add this type of services to their clinics. I personally started as a medical esthetician back in the days because I knew that I want to be a medical tattoo artist. The reason why I wanted it's from my personal reasons, that today it actually helps me to heal myself, but in the same time to heal others. So this is my passion. Now, regarding any type of certification, so it depends by the state, because every state have different regulations. For example, in Illinois specifically, there's no a specific school that give you the certification, because medical pigmentation or any type of permanent makeup falls under the category of body art. So this is something that we actually already dealing with the health department and by their requirements to have a license as a tattoo artist. But to have a specifically like a school like there is for an esthetician or cosmetologist, there is no such a thing.
Yeah. Okay. So I was shocked when I learned about all of the things that can be addressed using paramedical tattoos. Like you said, scars from surgery, self-harm scars, burns, vitiligo, hair loss. Where were you last year before I took my trip to Turkey? But the thing that I think I was most astounded with was the use of paramedical tattooing for breast reconstruction after, well, not always after breast cancer, but most times after breast cancer mastectomy. Can you tell us a little bit more about that?
Yeah, so this field is very unknown. A lot of, unfortunately, people, the community is not aware how it actually should be, or not educated. Unfortunately, there's no enough education to provide it for the community, because the plastic surgeon, it's not their niche. Nurses, it's also not their niche, and this is where actually the medical pigmentation art is actually coming in hand. I personally take it very seriously, so I'm very picky already. You know, you guys saw my clinic and how everything is work, but it's everything starting from the consultation to applying to insurance, procedure, how to communicate with the patient, how to communicate with the plastic surgeon, and just all this process in general.
And when does this process start for a patient? So if a patient has been diagnosed with breast cancer, do you see them before surgery? Do you see them after surgery? And if it's after, is it right away? Do you have to wait a certain amount of time?
No, I don't see them before the surgery. I'm actually, they're reaching out to me after the surgery, or they're reaching out personally because they got my information, or it's actually the doctors that actually reaching out to me and telling Ileana, hey, listen, we are reaching out regarding XYZ. And then they are coming for a consultation. Usually a consultation with me takes 1 hour. I really take the whole time just to, first of all, I'm analyzing what is their mental state. Like, this is a process. This is very important. We're not dealing with the flower or something. They already been through a process, and I need to understand where they are in that moment. If they're ready for that, how I can actually customize and to program myself for this journey and every step of the way, because every patient, they have their own approach that they need to have. After the consultation, then actually I'm reaching out to the doctor and check if they're already cleared. So we need to have a clearance from the doctor. And after that, we're scheduling the procedures. And after the procedures, I help them to apply for insurance.
And so your story, you saw Liana for breast reconstruction.
Yes.
After mastectomy for breast cancer. And I want to dig into that a little bit more because it's an amazing story. So I don't want to neglect some of the other things that you can use paramedical tattooing for, though, either. You said things like vitiligo, stretch marks. How often do you treat patients for things like vitiligo or stretch marks?
A lot. I have a lot of clients / patients. With vitiligo, it's 50-50. People need to understand this is something that it's not guaranteed, but there is results. It just takes sessions, and the results are phenomenal. It's just the process. With stretch mark, for example, 2 sessions and that's it. We don't have any stretch mark. But again, remember that how I was mentioning in the clinic, that there is 2 different type of procedures. So I was gonna ask you about that. There's 2 different type of procedures. So we're not jumping right away on camouflage. Everyone thinking right away camouflage. I am actually taking a different approach. I like to have natural results. So if I can actually have the results without having the camouflage and to have already the natural melanin actually restore itself, so I will take this approach. The only minus in this approach that it takes longer than a camouflage, but I prefer that than just to jump right away and to deposit artificial color into the skin.
And I'll be very honest, during medical school, Dr. I and I gained a lot of weight.
Don't bring me into this.
Bringing me Richter. And we both have stretch marks. It is what it is, right? So I asked Liana, I went to her clinic and I said, okay, if say I wanted to camouflage these stretch marks, would you recommend the paramedical tattooing, which is, using the ink to basically camouflage it? Or would you recommend something else? And she mentioned microneedling. So can you tell people a little bit about microneedling?
Yeah, so microneedling, it's more suitable in the aesthetic world, okay? When we're talking about medical pigmentation as a tattoo artist, we have a different name that it's called the inkless. So it's a type of microneedling, but it's have completely different approach.
So you're not using ink at all?
I don't use any ink at all, but I'm also not using any serum. As an esthetician, when you provide microneedling for the face area, you use any type of serums. With the Incus, it's very different approach, and this is something that it's very good to know for the audience. If you are interested to have it and you want to artists, if you see that they're using during the procedure actually a serum after they actually open the skin, it's not allowed in Illinois for tattoo artists actually to do so. We're able to do a dry needling, a dry tattoo, to be able to approach the scar and the texture and the stretch mark as is.
And the microneedling basically just stimulates your immune system to basically create scarring in that area, new collagen. And
Yes. So the difference between old traditional microneedling, as most estheticians use, compared to the inkless, that the microneedling, it's a bunch of needles between 12 to 32 needles that are together, and you target the damaged skin and the healthy skin. So the results are not that wow when it's scars or stretch marks. When we actually approach with the inkless, so every stretch mark individual is actually targeted by the figuration of the needle of the tattoo machine. So we're not touching the healthy skin, we target the damaged skin.
Okay. And one other thing I wanted to ask you, then I want to get to your story, of all these stretch marks. No, it's actually not about the stretch marks, no. But dealing with different skin types.
Yes.
So when I went to your office, you right away, you said you're, I think, a level 5 complexion, which you were spot on because you've got a machine that actually tells, people's complexion.
Yes.
But you also talked about something called the Fitzpatrick score and about people's skin temperature.
Yes.
What are you referring to when you talk about a Fitzpatrick score, skin temperature, and why is that important when you're dealing with different skin types?
So there is a device that me and my partner actually developed after a year and a half, and it's a very cool device that everyone can use. It's not just for medical pigmentation, it's for dermatologists, it could be for everyone. And it's very important to understand when you're making a formula for camouflaging, or even if you do microbleeding or even an eyeliner, you need to know what is the Fitzpatrick skin tone of the client. So as we know, we have 6 groups of skin tones. So for example, I can be 2, right? But you guys are dark skin complexion. Vivian is even between 4 to 5, even that she doesn't look like this. Now, I already see this from experience, but there's a lot of artists that are not that aware. And if we're not knowing the correct undertone, because there is a neutral, there is warm, and there is cooler. And if we are not knowing the undertone of the client and the Fitzpatrick skin tone, so the formulation that will be actually developed for camouflaging or using for any tattoo on the face can actually have a cooler healing. It can change to a too much cool or gray, or can become too much orangey or red, that we want actually to avoid it. So when we were talking about the dark skin complexion, it's very important to understand that dark skin complexion have very different approach in tattooing, because it's prone for hyperpigmentation, but it's also prone for hypopigmentation. So the approach should be very different. The healing process is different. The session between is different. So it's very important.
Super customized.
It's super customized, and it's very important because to be honest, I'm very known in the dark skin complexion community. I have people that flying in just that I will be able to help them, because unfortunately, there is in the community of the medical pigmentation or permanent makeup, they're not that aware of the difference and what could be the outcome in the end.
Wow, so I think there's just so much. It's amazing how much can be done with paramedical tattooing. I want to come back a little bit to the brush reconstruction and the areolar restoration. So Vivian, tell us a little bit about your story. What happened exactly, and how did you meet Liana?
Well, I had a horrific story to start off. Well, obviously, I was diagnosed with cancer. I had a bilateral mastectomy. In that process, I had multiple surgeries because there was complications. Even the implant burst, I had to go back into surgery. So I had a lot of scarring. My skin died as well. So it was very traumatic for me, mentally and visually. So as the process was taking place, I was like, okay, what do I do next? I need to do a tattoo. I need to do something. I wasn't aware of the tattooing that she does.
Okay, I was gonna ask you. You said I need to do a tattoo. So, like, were you thinking just like cosmetic tattoo, just to kind of
Just to cover it up,
Oh.
yeah.
So just like a design or something.
Yeah,
Not
so I was
paramedical
thinking maybe
tattooing.
some flowers, something in that area. But for me, it was a little different because my areola was not kept
Yeah. So
because there was cancer.
Oh, so there was cancer in the nipple, and they had to remove the nipple. Well,
So that was traumatizing for me as a woman. So I was like, okay, what do I do now? Then they had done lipo to take some of that to create my breasts. And while I was there, this young lady was like, she gave me information on it. You know that now there's this, there's that. And I was like, really?
Yeah.
So I wasn't aware of it, but it gave me hope. And I was like, okay, I don't need to look at the mirror to see all these scars, all this tissue that was created around this. So I went and I seen her. And from the beginning, I was so happy when I went home. She took the time to explain everything to me, to show me other patients. And I was like, hey, I could do this. I could feel myself again. Because as a woman, after you go through a bilateral mastectomy, your life changes, especially when you're big chested. So, and I'm like, okay, do I want to go back to that size? What do I want to do? So it's a combination of a bunch of emotion.
Yeah.
So,
So do you feel like the transformation for you, there was definitely a physical transformation, right?
yes.
But do you feel like the emotional transformation was bigger than the physical? Like, how did you feel emotionally after it was done? I guess before and after.
Well, I went through a journey, right? Because I had to journal every process.
Yeah.
So when we came to the day that we were able to do it, I was very emotional. And she tells me, well, record what you're feeling. And I'm like, but I can't. So I did. And I think that was part of a healing for me as well, because I couldn't believe I was actually going to see something and not feel any complex, I would say. So when we were done and she's like, okay, stand up, look in the mirror, I was like, wow, I'm alive again, as a woman, because for some people that doesn't matter, but from someone that was very big chested, it was like, okay, what do we do now? And I chose to go smaller because that also brings back pains and things like that. But again, it was just a mental thing for me, a visual thing for me. I was single at the time, so it didn't matter. But now I just told her today I'm getting ready to embark in marriage.
Congratulations.
So that's another season. Okay, am I gonna be able to disclose myself? And it looks real. Honestly, it looks real. It looks amazing. So you feel whole again.
She shared some of the results with me, and it's amazing. No,
Yeah.
it truly is amazing. You see the before pictures when there's, the scarring, and you see the after pictures, and you truly wouldn't know.
I know.
Anything was done.
As a gynecologist, we look at breast all day, right?
Right.
Look at what we do, and looking at the pictures after, I'm like, I don't know if it's maybe the picture's small, but I really can't tell the difference. Like, I'm really looking, like it
looks
changes.
so real. The 3D effect is amazing.
I literally was gonna say it's that 3D effect,
Yes.
because when I picture, now I'm a horrible artist, so anything I picture in my head,
Stick figures.
just standpoint's gonna be bad. But I'm thinking like how, I just picture this 2D circle, but the 3D effect, which we're gonna have to come out someday, you're gonna have to show us how you do it. It truly adds this depth that makes it look so real.
Yes.
Yeah.
And see, that's the thing. When I went to her, I didn't know how real they will look.
Yeah.
And to be honest with you, until it's completely done, you really don't get that feel of it. So once we were done, I cried.
I can imagine.
I cried. I went home and I was still crying. I showed my kids and they were amazed with how it looked. So I always say now, because I do speak with other women that have breast tissue and complications and things like I went through. And I'm like, you can smile at the end. As you're going through it, of course, there's going to be emotions. But I can honestly say I had tears of joy. Like, I just looked at her, I hugged her, and I was like, oh my God, like I feel like a woman again, And that's what I want other women to know and understand that, yes, it's a painful process because nobody wants to go through that. But to know that there's people like her that care and are willing to help you in this journey and make you feel like a woman again, is such an amazing thing to have, So
What was people's reaction? Like when you told family, their friends, I'm gonna do this, were they like, huh? Or like, how do people react?
they didn't understand, just like I didn't understand at first. I'm like, I didn't know about this. I didn't know about that. So I sat down and then we had our girl powwow, you know, and everybody's like, well, are you going to show me or this? And I was like, well, you know what? Here, look, you know, but it took time to do that. And again, that's with your girlfriends. Now we're talking, I'm going to a different setting now. And I'm like, okay, Lord, am I ready for this? So I just told her, I want to touch up, freshen it up before I take that process. So, but I would recommend this to anyone going through this situation, because again, the mind really plays tricks on you, and you want to know that you can feel complete and whole. So,
To a large extent, we are what do we feel we are.
yes,
You know?
yeah.
And what do we see when we look in the mirror, I think, is what we tend to project to the world.
Yeah,
So other people may look at you and say, like, oh, you're fine. But if you don't feel that, if you don't see that, you don't project that, you don't feel it, you know?
One question I'm sure patients are going to want to know, is it covered by insurance?
Oh yeah, 100%. So, it's by the law, by the Women 1988 or 1998, if I'm not mistaken, by the organization. It's by the law that everyone that had any type of mastectomy, any breast cancer, areola, should be covered by insurance. Now, if it's 100%, it already depends on the deductible, of course. But all of my patients, there was no any case that it was not there is no even such a thing, and I even don't take it even as an option. If there's any issues, I already called right away. Like, the insurance is actually already reaching out to me just to check a few things. They already know about me, so when they see, actually, I was reached out by Blue Cross Blue Shield, and it said, listen, we just want to let you know that your name is already here. You're already like legit. So when we see a patient from your name, it's all good.
So it's covered by insurance.
Yeah, I didn't know that. I learned up. And it's a blessing. That's great.
I'll have to tell you guys, this has been an amazing conversation. I think that school will find your story inspirational. They will find your work to be amazing, because it is. Where can people find you guys?
Well, I'm in Highland Park, Fancy Schmerzi. You can see me on Instagram, on Google. I'm with you guys also on Instagram. So you can find me. You can fire me.
Anything you want to share in terms of
just don't give up. Advocate for yourself as a patient. Don't be a number to a doctor. Just speak up for yourself, you know?
Well, thank you so much for joining us.
For it, that's guys. Thank you for having us.
Today we had amazing conversations with Dr. Kaminska, Liana, Vivian, and this appointment is almost over. But first, our prescription TikTok.
See this term all over social media, Ozempic face. What is that, and why do people think that a GLP-1 changes somebody's face?
Well, it's not the GLP-1, it's the drop of rapid weight loss or significant weight loss. And why is this? Because of not eating enough protein. So as you lose, if you're losing muscle because don't have enough protein in your diet while on this medication, you're not only gonna lose muscle, you're gonna lose hair, you're gonna lose elasticity in your skin, because we need protein to make collagen, elastin, right? Also, you need muscle to fill the gaps of the fat loss, right? The goal here is not skinny, it's strong, it's fit. So you need to fill those pockets with muscle. Now, if you're not losing muscle by increasing your protein intake, then you're gonna make enough collagen. You're losing weight slowly, so you're allowing your skin to adapt to the changes. But if you lose weight rapidly, it means that you're also losing muscle. It means that don't have enough protein in your diet, so you're not making collagen and elastin.
It turns out that Ozempic face isn't really Ozempic face. It's basically rapid weight loss face. What happens is when you lose weight quickly, you don't just lose fat. That's the desired effect. You also lose muscle and protein in the skin, and that's what gives you that sunken in, drawn in face.
Exactly. So when you're losing weight, no more than 1 to 2 pounds per week, and you want to eat 1 gram of protein for every pound of body weight. That way you're not protein deficient.
If you keep up the protein, slow pace of the weight loss, you will avoid Ozempic face. And with that, this appointment is now done. As you make your way to the waiting room, please stop by the receptionist.
Yes.
And don't forget to make your next appointment for a second opinion with the Twin Doctors. I'm Dr. J.
I'm Dr. I, and we are the Twin Doctors, and this is Second Opinion.